Good evening, everyone. This is Sally McKenzie from La Jolla, California, and President and CEO of McKenzie Management. And I want to bring to you this evening the webinar on productive scheduling. I hope everyone had a very enjoyable day today, and I just can't thank enough all the people from all over the world that have shown an interest in this particular webinar. And I also want to thank Viva Learning for their help in producing this. Excuse me. So let's get started. Productive scheduling is, obviously, this is the key to the dental practice. I mean, if we don't schedule, we don't work, and we don't have any money, and so on and so forth. These are, excuse me, the most common signs of when we understand that the scheduling system is broken in some way. It is extremely frustrating, and it's not normal for you to have ups and downs excuse me, in production, fluctuating, so that you don't ever really know how much it is that you're going to produce. That's not normal, and please let that be a sign to you that the production, or the scheduling, I'm sorry, is broken in some fashion. The second one is that patients waiting more than 4 weeks for an appointment. Now, I'm sure that probably not too many of you now, with the economy the way that it is experiencing that so much right now. But we can see that, for example, in the hygiene department with offices that pre-schedule 6 months in advance. The point I want to make is that whether it's in hygiene or doctor, but let's just talk about the doctor's schedule. The doctor should not be booked any more than 3 weeks ahead solid, with appointments spilling into the 4th week. And the reason for that is poor customer service. So you have a customer that wants to get in, they want to buy something from your store, so to speak, and they can't get in there because of a scheduling issue. So that's what we don't want to happen. That's another sign that there's something not right with the scheduling system. Working into or through your lunch hour or getting out late at the end of the day excuse me, are obvious ones that employees, it causes employee issues. I mean, even the doctor, no, it makes you all leave feeling bad. So you don't want to get out late and so on. I feel like you're on roller skates all day long. Of course, holes in the schedule is a real downer, and it causes a lot of morale problems. I know how frustrating it is when you're like, you've confirmed people the day before, and then they still don't show up, and it just is frustrating. People not putting a value, on your time. And of course, I also know from doing a lot of work in personality testing that for some, front office people as well as the dentist, it becomes really even more frustrating. Too many emergency patients can also affect the schedule. Especially we see this more in practices that are not actually doing, excuse me, treatment planning. But it kind of like it hurts doc, fix it, and so on and so forth. And if you allow that to happen, then the patients basically take control over the schedule rather than the office having control over it. And then, of course, that ends up into your fluctuating production situation. Do we have any doctors out there who talk too much? I'll bet you that we do. Because what happens, it's just so funny because some of the newer designed offices are actually building like bars, in the hall, like in the hallway, to and because I say to the dentist, I say, what, you're taking so much time there. He said, well, Sally, I'm bonding, with the patient. Well, the problem, is that you can bond yourself out of $100,000 a year in production. So it's can you at least bond? Can you bond with them out in the hallway? because I have got to get this room cleaned up. You know, that's what the chairside assistant is saying. And it causes, of course, inefficiencies. There's a fine line between building rapport with a patient and then talking too much. So there has to be a happy medium in there somewhere, so that we can at least stay on time and we can provide the customer service that we need. There are 3 different types of scheduling in a practice, and I refer to them as crawling, walking, and running. I've coined those phrases that we work with our clients on. There is no right or wrong in scheduling. There's different personality types. There are some doctors out there that are just like the Energizer Bunny. They're like, okay, bring it on, 50 patients, I can do 10 more, bring them on. And then you have doctors who come into the beginning of the day meeting and they look at their daily schedule and say, are you kidding me? You're expecting me to see 4 patients today? So you have different personality types, you have different walks of life and different energy levels, and therefore you run into different types of scheduling. And so I don't want you to think that I got to do it this way, that it's you're right or you're wrong. It doesn't work that way. But my job is to help you to make an informed decision on the different variations in the type of scheduling and what they actually can bring to the practice. When we go across the country consulting with practices and we analyze scheduling, we go into the office and we say, Betty, I notice that you are scheduling patients in 2 columns in the schedule. Can you please tell me, how do you know who goes in the left column and who goes into the right column? And she will say, well, doctor wants all of the high dollar volume, production items in the left column, and then I can fill in the right column with other things besides that. So on this slide, I have illustrated what we commonly see. That is how not to schedule. It is an incorrect way of scheduling. And my point is that looking at this slide, you can clearly see where she has the dentist scheduled in 2 different operatories at the same time. And of course, this promotes poor customer service. This also will result in, the office running behind, getting out late for lunch, getting out, late at the end of the day. So this is not how I would advise you to schedule. Now, let's first look at the most conservative way to schedule, which would be the crawling. And you can see that I have these patients on 15-minute units, which is a very old type of technique, and of course dentistry gravitated towards 10-minute units simply because there were 4 options in an hour, 6 options in an hour instead of 4 on 15. But whether it's even on 15 minutes or 10 minutes, my illustration in this most conservative way of scheduling is utilizing 1 dental assistant and maybe 1 or 2 treatment rooms. And it took this dentist from 8 to 12 o'clock to do the procedures that you see there. So we've got 2 class 2 fillings, we have a seat crown, we have bite registration impressions. We don't have anything earth-shattering going on in there. But this is the most conservative way to schedule. This particular dentist, who schedules one right after the other like this would and had good patient retention in the practice would certainly need an associate dentist before one who would schedule in the walking or the running phase, which I'm going to share with you, for example. Now, I'm going to take you from the crawling phase, and I'm going to take you directly now to the running phase of scheduling. So I'm going to bypass walk, and I'm going to take you right from crawl to running. These are the same patients, same procedures, now charted and scheduled on 10-minute units, now done in 2 hours and 20 minutes, utilizing 2 treatment rooms and 2 clinical assistants. So obviously this doctor has an hour and 40 minutes more now to schedule simply because it's been recharted and rescheduled in a different fashion. So for illustration purposes, the straight line, the straight red line that you see to the left of Jack Simmons would be the indicated as the assistant time, which many of you can indicate on your practice management software. The squiggly line would indicate the doctor time, and the straight line would indicate the assistant time. This is known as expanded function scheduling, and so the time that is communicated to the front office scheduling coordinator is always communicated then as a 3-number formula. So for example, this 10 minutes right here is 10 minutes of assistant time. Then we have 20 minutes of doctor time and 10 minutes of assistant time. This would be communicated then to her as a 1/2/1. The scheduling coordinator then knows that the designation of the 3 numbers given to her by the clinical team, the first number is always assistant time, the second number is always doctor time, the third number is always assistant time. So for example, let's look at Matthew Leach here. So we have 10 minutes of assistant time to seat the patient. The doctor always gives the anesthetic within that first 10-minute time. We do not give the dentist a solid block of 10 minutes to give anesthetic because it doesn't take that long. And then you can see the 30 minutes for doctor time. And then you see there is no assistant time at the end because the assistant is not placing the restorative material because it's illegal in this particular state. So this then would be communicated to the front office person as a 1/3/0. So there's always 3 numbers given, and if there is no assistant time or doctor time, they are always indicated by zeros in the schedule. Now, this type of schedule it doesn't suit everybody, because especially if you have hygiene exams, and the more hygienists that you have on top of that, it can be very frustrating for a dentist who is going to be more laid back in his or her personality type and how they want to work. So it's just not necessarily for everybody, but it's to show you, like for example, when a dentist will call me and they say, Sally, I think I need an associate dentist. Well, why do you think you need an associate dentist? Well, my schedule is booked out really far in advance, and I can't answer that because the first thing I want to see is how are they scheduling. and I want to see whether or not I can rechart the way it is scheduled, reconfigure it in order to condense the time, and the dentist is still, happy with that and maintain the quality. So it doesn't always necessarily mean that you just, because your common sense tells you, oh, we're booked out far in advance and, we're losing people, we've got to get another dentist. Well, let's see what we can do with that first. Now I'm going to take you backwards to the walk. So we discussed crawl, we went right to run. So if you're in the crawling phase of scheduling, the next step, the next conservative step would be to take the schedule to the walking schedule, which is simply just overlapping the first and the last 10 minutes of each procedure, utilizing 2 columns in the schedule, and of course 2 treatment rooms are also needed for this. Now, it is a management myth that's been circulated around for a long time that you need to have a dental assistant for every treatment room that you work out of. And this schedule, I'm trying to illustrate to you where that is absolutely false. If this practice had 2 dental assistants, I have taken the time opposite the red bar, for example, in green here, to illustrate that if you had 2 assistants, so one assistant's over here with the dentist, the other assistant is over here struggling, trying to find something to do. And believe me, there are only so many cotton rolls that you can stock, okay? And I'll tell you that it's quite common for us to see that if the practice did have 2 dental assistants employed with this type of schedule, simply because there are 2 treatment rooms and 2 columns, we will probably also see the payroll expense be beyond 19 to 22% of the revenues as well. So not always, but I'm just saying that this is what we see commonly. One kind of goes hand in hand because the practice honestly doesn't need 2 dental assistants. Here, if the dental assistant, now let me just say, there's exceptions to every rule. You can have a dentist who requires a dental assistant to do all kinds of laboratory work, for example, and you can have another dentist that doesn't require that at all. So there's always exceptions to what I'm saying, but I'm talking about in generalities. If a dental assistant said, let's say a head dental assistant says, oh, there's just no way. There is absolutely no way that I can do that. I guarantee you there's inefficiencies then in the instrumentation setup, how the treatment room is turned around, perhaps in the sterilization process, because I know that this can be done very well by one assistant. So there's inefficiencies and problems that are lurking someplace else. Now, let me talk about block scheduling. Block scheduling is a concept, and it's a concept of holding, specific times in the schedule for specific procedures. I don't necessarily agree with it in its entirety, because it can promote poor customer service, especially if the dentist is very headstrong in that, I only want to do this at this time of day, and so on and so forth. And of course, it's the dentist's practice. The dentist can do anything the dentist wants to do. But there are always consequences for those kinds of decisions. So I remember a practice years ago that wanted the first 3 hours of every day blocked for crown and bridge, and then anything else could be scheduled in the other times of the day. Well, a patient who needed a filling couldn't get in for about 2.5 months, but a patient that needed a crown could get in tomorrow. So there's a difference between what is reality and really what the vision is. So my recommendation is that if you are going to block the schedule for specific procedures, then I would recommend that you do it in diversified times of the day, different days, to have customer service to accommodate the patient. Obviously, as I state here, the times must be filled 48 hours prior, and most importantly, you have got to go back and run a production procedure analysis report. The report you see here on the left happens to be a Dentrix report, but all of your software have this type of report, and I want you to go back and run it for the past 6 months or run it for the past year, and then add up how many molar root canals that you did, and divide that by how many days that you worked in the time frame that you specified for the report, to find out how many that you are doing per week, that you are doing per day. And then you can block the schedule based on the historic performance of the producer and not just your vision of ideally what it is that you want to do. Many times I do certainly agree with blocking hygiene schedule if they come through hygiene, whoever they come through, doctor or hygiene, that's a whole other seminar, on new patients, because you must get the new patient in within 1 week. But also then you have the perfect day. I don't necessarily agree with the perfect day either. I believe that blocking, color blocking, and so on and so forth, I believe that honestly that was put into place because somewhere along the line people did not believe that the scheduling coordinator really had what it took to get it to a specific production goal per day. And I just disagree with that. I believe that they do. I believe that, knowing how much that you have to produce per day and that they can do that. I mean, there is certainly the situation of where we see a lot of front office employees that have not received proper training, and that's usually the downfall of it. They've not been professionally trained on how to schedule. Let me just throw something else out there too that comes to my mind is sometimes I've seen in the past, and I certainly don't mean to offend anybody, but I've seen in the past that sometimes the worst scheduling coordinators are former dental assistants in that practice. And the reason is because they, in quotation marks, they just know how much the doctor takes for this procedure or that procedure. So the doctor and the present clinical assistant then get comfortable and lackadaisical in expressing exactly to her how much time the patient needs because she just knows. The other thing that will hurt the schedule too, we've been able to prove quite frequently, is if the practice has any kind of template of scheduling. So, I need X amount of time for how many surfaces of the tooth that I'm doing, for example. Those don't work either. I mean, you have patients that gag, you have patients that don't gag. You have patients that talk, you have people that don't talk. So it's if you can try to customize it more than standardizing it, then you will be a lot better off. Meetings, daily meetings are extremely important. I don't care how big the practice is. I don't care how small the practice is. What we find is that most offices usually, when they have their daily meetings before the day, and the ideal time is before the day starts. But it's, we've had practices say, oh, I can't do it before the day starts because they've got reason A, B, C, D. Then if there's a will, there is going to be a way to do it. So it doesn't make any difference if you do it at lunchtime. You do it for the afternoon of that day and the morning of the next day, for example. But to have them sometime where you are being proactive in talking about And I don't want you to talk just about today schedule. Yes, I want you to talk about it, but not just that. Because today can be too late. It's too late to do anything about it. So the scheduling coordinator, it's very important that, you're looking, at a monitor, or she's bringing the schedules for the next 2 days worth of schedules so that you can be proactive to advise her. Oh, I don't need that much time on Sally McKenzie. Let's reduce that, get another patient in there. You just advise her instead of just coming in the beginning of the day meeting and and then it's not right and everybody's scrambling, at the last minute. I want you to be proactive. Now, the monthly meetings are also very important. And of course, the monthly meetings, we recommend 2-hour monthly meetings. And of course, there's a lot of the systems and patient retention and accounts receivable and so on, so different things that have to be discussed. But we're talking about scheduling. I would recommend that the scheduling coordinator then be responsible for bringing and reviewing over, the missed appointments report and the current missed appointments report and the unscheduled treatment plan report. I even teach scheduling coordinators to, or if you have a treatment plan coordinator, whoever is accountable for that, to bring to the meeting, like for example, the last 3 months, the unscheduled treatment plan report had $322,456, on the report. And I'm happy to report that based on my efforts of contacting the patients, I was able to secure $15,323 worth of treatment. And so just being accountable and saying, how much she's been able to secure back into the schedule from that report. Reviewing over the missed appointments report. Who is on there? It's so frustrating to hear doctors, and even staff talk about that they have holes in the schedule, but yet these types of things are not really reviewed and they're not discussed and nobody is accountable and nobody's up there dialing for dollars. I mean, you've got to make it happen. Yes, you can sit back and whine about it, but whining doesn't do any good. You've got to take action and really, step up to the plate, and that's why the meetings are so important for you to get to be together collectively. One person might know something about this patient that the other person doesn't know, and that may very well help to secure treatment along the way. Time is money in dentistry, as we know, and so it's very important for everybody in the team, especially the scheduling coordinator, to understand about production per hour and how much it actually affects your production, how much money has to be made every hour, every day, every month, because everybody in there has financial objectives. I mean, bills have to be paid, employees want raises, the doctor wants to be more profitable, and, it's just not pennies from heaven. It just doesn't work that way. So, again, understanding, and clearly understanding and knowing how much the practice has to produce is an important next step. So this is how to determine the production per hour, and I highly recommend that you do an analysis on every single procedure that you do, every single one. So let's look at this. So for example, you have a crown, and the procedure time, for example, might be 60 minutes for the prep and 30 minutes for the seat. So it takes this doctor 90 minutes, 2 appointments to do the crown. Let's say the fee is $950. So to do the production per hour, you take the fee divided by the time that it takes you to do for the procedure. So in this example, that's $10.56 per minute. times 60 minutes in an hour, that dentist is producing $633 an hour when crowns are being made. Now, look at what happens if we just simply decrease the preparation time from 60 minutes to 50 minutes, just 10 minutes, and we increase the fee $50. The production per hour goes to $750 an hour. I mean, it's really amazing. And we find dentists and dental assistants that they never question their amount of time. I mean, we have doctors that have still been using the same amount of time for a crown prep that they did when they got out of dental school. I'm just saying that if you want to increase your production per hour, then ask yourself, challenge yourself, sit down with your dental assistant and say, listen, I'll bet you we could decrease the time for our prep by 10 minutes. Let's try it and see if we could. You know, it's like you don't try, you don't even know if you can or not. You know, being very objective and looking at the whole procedure time that you take. You know, each 5 minutes or so, and you know, maybe we could cut that out, maybe we could, you know, do that. Or I notice that you leave the treatment room a lot to go get things, you know, how can we stop that, you know, and make that better? Challenging yourself to do a little bit, you know, more in that particular area. And so to, you know, like to further illustrate, for example, I mean, I can have a dentist on the left side of the street who takes an hour and a half for a crown preparation and 30 minutes to for the second appointment to seat the crown. So it takes that dentist 2 hours to do a crown, and that's a very common time frame, I will say. And let's say that the fee for the crown is $1,000. So it takes 2 hours, the fee is $1,000. That dentist is producing $500 per hour. Now I can go across the street to the right side of the street, and I have a dentist over there who's taking 20 minutes for a crown prep. The preliminary impression, opposing arch, temporary crown is all delegated to the dental assistant legally by law and trained. And the second appointment to insert the crown is 10 minutes. The assistant takes the temporary off, cleans off the preparation, puts the permanent crown on, checks the contacts with dental floss, has the patient bite down gently on articulation paper. The doctor comes in, 0 to no more than 1 or 2 adjustments. Great lab, great prep. Cements mixed, and so a lot of that is delegated to the assistant legally by law. And so 10 minutes doctor time only to adjust, and cement. So that dentist on the right side of the street, 20 minutes prep, 10 minutes insert, total time 30 minutes to do the crown. The fee's $1,000. That dentist is producing $2,000 an hour. $2,000 an hour on the right side of the street and $500 on the left side of the street. Now, I'm not a dentist, so I can't, judge, but I can tell you that the dentist who is doing $500 an hour is convinced that the dentist who's only doing, 20 minutes for the prep has got to be doing lousy dentistry. That's very common to hear that. I don't know. I just know that it is being done, and that dentist doing $2,000 an hour has great patient retention, and I'm not aware of, crowns falling off, for example. So, it's the same thing like I can have a dentist on the left side of the street that does a molar root canal in 1 appointment, and I can have a dentist on the other side of the street that takes 2 appointments for a molar root canal. So I just want you to be to challenge yourself if you're so inclined. I mean, if production per hour is not exactly where you want it to be, then perhaps that's something that you can entertain that will help increase the production and the scheduling help with the scheduling as well. Of course, you have to have goals. The scheduling coordinator has to have goals. The business has to have goals because the business has to make X amount of dollars. It has to make money. It's a business. So in establishing the doctor and the hygiene goal and looking at, how much per hour, per day, how much per 10 minutes, let's just say that your yearly goal is $1,114,000. Industry standard for a general dentist is that the hygiene should be producing about 1/3 of the practice's production. So in this example, 1/3 would be $376,620. On a side note, I have a free practice assessment that can be done on my website, and these, when you do these, they come directly to me, and I respond directly back. And so I see a lot, this is one of the things that I measure. So I see a lot of hygiene production at 24% of the practice production, at 18%, but I'll see it more in the 20s. And if that is, it's very easy for you to measure if that is the case, then there's obviously room for improvement. There is, this is a missed revenue opportunity for this dental practice, that there's a reason behind. So that's a symptom. That is a symptom of a broken scheduling system. It could be a symptom of a broken patient retention system. It could be a symptom of a broken periodontal assessment system. It could be a symptom of a broken communication system. But it's somewhere. It's because that's what the figures, are revealing. So it's important to understand how to do a diagnosis, to see these particular areas, and to know then that this really is a problem. So hygiene is doing 1/3, then that is going to leave the doctor's production at $737,380. Now, assuming that there's only one dentist in this practice, what if you had 2 or 3 or 4 dentists in the practice? Then you would need to do the math to figure out what each doctor's production is, let's say for the past 6 months or the past 3 months. I wouldn't just do it for 1 month, to find out what percentage of the production each doctor is, producing. So Dr. A is producing 37% of the production, and Dr. B is producing 28% of the production, for example. So, but in my example, this is one doctor leaving the production at $737,380. So then, just again, this is an example, a dentist working 4.5 days a week, working 48 weeks a year, is 216 days a year. That is $3,414 a day that the dentist has to produce in order to reach that yearly goal. If the dentist is working 8 hours a day, then that would be $427 an hour, or $71.13 per 10 minutes. So it's very important to, again, to break it down, by day, and break it down by hour, and break it down by 10 minutes, so that the scheduling coordinator clearly, understands what that is. Now, why does she need to understand how the value of 10-minute unit? And the reason that she needs to understand it is because I want her to be accountable and reporting to the dentist at the monthly meetings how much money the practice has lost in unscheduled time units per month, because the brain just doesn't comprehend as quickly, or the brain doesn't feel the impact when we say, oh, well, doctor had 152 unscheduled time units this month. But the brain clearly understands that if there were 152 unscheduled time units at $73, the practice lost $11,096 in production. And an unscheduled time unit, I mean, if you want to report this is how much we're in cancellations, this is how much people that didn't show up, or it doesn't really make a difference. It just wasn't filled. It was just lost time to the wind, that we didn't produce anything. So doctors, this is definitely something that I would recommend that you put into place for the scheduling coordinator, and that you in fact would expect to know this information on a monthly basis. Now, there is the other thing with scheduling is when you have openings in the schedule, and filling them, and who's accountable, and so on and so forth. What I would suggest, and this is a standard of what we teach in my business, in our consulting work. If you have less than a half-day notice of an opening in the schedule, then yes, I would go to the future, next week at the same time, whatever, to fill it. Because when we ask scheduling coordinators across the country, if you have an opening in the schedule, do you fill it? And she says, yes, I try to. And we say, well, where do you get the people? And she says, I go next week and move somebody up. Well, when you do that, you're just robbing Peter to pay Paul. You're not putting any more production on, not new production on the schedule. You're just shuffling it from one day to the next. Excuse me, but I agree with you that, if you have a short period of time, then you have to get it filled, really, really quick. So one of the things that you need to do every time a patient is dismissed is I would suggest that you say, Mrs. Smith, if you would just confirm your appointment card that I've written out here for you. It should say that you have an appointment next Tuesday at 3 o'clock. You should expect to be here for an hour. If I should have an opening in my schedule before then, would you like for me to give you a call? So many of your practice management software systems have a short notice list, but if you don't ask the patient, then you're not able to fill it. So you have to ask in order to build that list. That list just doesn't happen, automatically. And so that would be my suggestion, to do that. Now, if you have a half day or more, let's say it's 9 o'clock, in the morning, and your 3 o'clock patient cancels, then you need to get on the phone and start dialing, for dollars. Missed appointments, the tickler file report, unscheduled treatment plan report, people who need treatment that aren't, so you can begin to bring people new production that is not already accounted for onto the schedule. And of course that is time consuming to do that. And that's why most of you don't do that. And I know every situation is different, but we find scheduling coordinators, and I use the term that they get bogged down with priority confusion. When I say priority confusion, they have this to do, they have that to do, they're convinced that they're going to get fired if they don't do task ABC, for example. So this has to be an open discussion, you know, within the team. You know, if that the daily schedule's not done, or I don't have the records together, or that I don't have the routing slips together, or whatever, because I had to spend the last 2 hours of my workday trying to fill the schedule. So that they know that scheduling coordinator is putting out the effort. You know, the back team, the clinical team knows that she's responsible, she's accountable, she's a good person, and she's doing everything in her power to make it happen, and you support that. So because I just don't want her to get bogged down with this priority confusion of what it is that she has to do in getting your schedule filled. So let me see, let's go through now, and I've got a little bit of time left here, and let me see, I want to see if I can answer some of the questions. Let's see. What do you recommend when dealing with patients that miss appointments? Well, of course, they have to be confirmed. I've heard people say, oh, don't confirm the appointments, they need to be responsible. Well, I totally disagree with that. If I owned a dental practice, they would be confirmed. They would be confirmed, the day before. There's different modes of confirmation, email confirmation, text confirmation, the telephone confirmations. And so whatever method you're using, it's very important that you have done a study and I would constantly do this analysis to determine whether or not what you're doing is working. Is it working? We've seen offices that say, oh yes, I confirm the appointments, but actually what is a confirmation? I mean, if you're going to call to me, the confirmation is that you spoke to the person, that you spoke to the patient, that you didn't leave a message on an answering machine. You can't take the monkey off your back and put it on a voicemail, because it's just not, responsible. So that's the first thing. Did we speak to these people? If we confirmed by email or text, did they confirm back that they were going to be there? If the appointment was made more than 2 weeks ago, then I would recommend that it be confirmed 2 days before, not the day before, especially if you are in a situation of where if you're in, I totally forgot what I was going to say because I was looking at the questions come in. I apologize. Let's go back to this. People that miss appointments. What do you recommend when dealing with patients that miss appointments? I do not recommend in charging the patient. I just don't. I don't agree with it. I think it's pretty difficult to try to collect legally as well. But it's just not a way that I would reprimand patients. I would do it verbally. So I would lay the appointment card up on the counter, and so the patient knows that they have that. If you have a consistent issue with people missing, I have instructed scheduling coordinators to say, Mrs. Smith, if you'll just look at your appointment card, it should say you have an appointment next Tuesday at 3 o'clock. You should expect to be here for an hour. Mrs. Smith, I'm not really sure what's been happening lately, but we've had a lot of patients that just have not, they've missed their appointment. So it's very important that if for any reason that you're not able to keep the appointment, please give our office a call at least 2 days ahead so that we can, have the time to give to another patient. So I think it's important to reiterate your policy verbally to the patient, and sometimes I've even put my hand out and on their arm and just say, I know that you haven't done this, but we're just making it a standard protocol to express this to all of our patients. you'll notice that I did not say call us 24 hours ahead. How many appointment cards? I say call us 24, give us 24 hours notice. I don't think the brain understands 24 hours. Let's see, what would 24 hours be to that? Just simply just say, call me. I just need to know the day before, or call me 2 days before. And I would have that on my appointment card if I owned a practice. I wouldn't just say that. If they miss the appointment, you have got to call within 5 minutes from the time that they are not there. And you've got to try to reach them. You've got to, and I would recommend that you make them feel like they had an accent or something. Oh, Mr. Smith, hi, this is Sally from Dr. Ryan's office. I was so concerned. We were expecting you for your appointment at 3 o'clock, and it's 10 after 3. Is everything okay? All right. Now, the ones that really aggravate you are the ones that say, oh, yes, I forgot about that. And you just talked to them the day before. So if you have a person who is consistently doing it, and you can't say, oh, three times and they're out. You can't say that. You have to listen to what it is that the patient is saying to you. And you as a scheduling coordinator have to determine if you feel they are lying to you or not. And if you feel that that is the case, then I would simply say, Mr. Smith, I'm sorry that we're having trouble coordinating a time excuse me, that's convenient for you and for our office. I don't have any open appointment times right now, but I do have your information here, and I'll give you a call as soon as I have an opening. And that's how I would approach it. Obviously, there's a line with fine line with a dentist being in the middle of the procedure, which you know is illegal. You can't do that, so you have to play all that situation by ear as well. But that's how I would handle missed appointments. I do not believe in charging the patient for it as well. You also have an option, with there can be socioeconomics coming into place, different geographical parts of the country. The socioeconomics and the educational level can vary from practice to practice, the types of patients that you actually treat. I also believe it's an option for you to require scheduling deposits. So if the patient is going to schedule for 2 hours or 3 hours or whatever it might be, that you can require a deposit that would then be credited to their to their account. Then there's always the question, well, what happens if they don't show up? Do you refund the money, and so on and so forth? We're not aware of that really happens. That the patient that does pay the scheduling deposit and has reserved the time usually is pretty respectful of that situation. So I do think that can be done, and of course some of the offices, with large treatment plans, especially in the past before the recession hit, not so much with the recession anymore, required patients to pay for the entire treatment plan up front. So, as I said before, you can do anything with your practice that you want to do. But anytime you set yourself over here to the left side of the street, different from all the other dentists that are on the right side of the street, there usually will be consequences to pay for that. So anytime you put a change in a system, it's very important that you have a way to measure what is actually happening. You measure the results of your efforts that you have put in, into the change, because you have to know whether or not that change is causing a positive effect or a negative effect on the business. Another question, what should we do if the appointment has been confirmed? You have 30 minutes for a treatment and the patient arrives 10 minutes late. Well, I can tell you what actually happens based on different personality types of front office people. For sure. The temperament type where the rules are the rules and you just broke the rules, that person will say, well, I don't know if we can see her or not. It'll just be in total disgust over the situation. A person who is very high feeling and a lot more, empathy will handle it in a different way. I would sort of the patient came in, I think I would say, is everything okay? We were expecting you for your appointment at 3 o'clock. Let me see, what we can do here. I still think that it would behoove the dentist and the clinical assistant or whoever's supposed to see this patient to bring this patient back. It can be very frustrating. There could have been an accident, going through traffic, and so that patient has high anxiety level trying to get to your practice to say that we can't. I mean, can you at least bring them back and do something, just something, with the patient? And then, of course, I think contacting the patients, maybe perhaps the next patient, to let them know. And so maybe it's a situation of sometimes where we're running consistently 10 minutes late throughout the whole rest of the day. But I do think it's important to inform the next patient so they know that they have a little bit of flexibility. But until you've walked a week in the shoes, or the day in the shoes, or the hour of the shoes of the person, especially on a 30-minute appointment, who really has put out their best effort to get there, I really believe needs to be respected. I'm sorry that I don't have time to answer all of your questions, but I feel free to email me. You see the info@mackenziemgmt.com on the slide, and all those emails come directly to me. I will be able to view all your questions later, and so I may answer them in the next day or two. So if you get an email from me, don't be surprised that I will try to answer each of your questions. And I invite you to visit my website at mackenziemgmt.com. There you will find the assessments that I spoke about. So the free practice assessment, I have one on overhead and cash flow. Those I'm happy to answer as well, and give you an idea about what I find with your practice. And of course, we've got the toll-free number 877-777-6151. I invite you to go to my Facebook page, Mackenzie Management on Facebook, and where we have specials that we will give to you there as well. And you can also view the specials on my site, practicemanagementlearning.com. And I also invite you to go to the On-Demand CE. There actually is a course on there on broken appointments and cancellations. So you can, after we finish this tonight, you can just go right in there and check out that course too. So I definitely have more specifics on that course about missed appointments and cancellations. So I thank you all very much, and I apologize for my coughing, but I've actually been sick the past couple of weeks, and so I'm happy that I got through this the best that I could tonight. So thank you all very much, and I'm here to help you in any way that I can. Have a pleasant evening. Thank you.